Good day, I'm Abrece, and today I'll be performing my written demonstration on how to administer our total parenteral nutrition. So first, what I'm going to do is I will be verifying the physician's order together with my initial preparation of the necessary materials that I will be needing. So first is I will be getting my patient's chart. So I can see here that patient John De La Cruz, who is a 68 years old male patient, is ordered by the doctor to be administered by Tpn solution. So make sure that we have the correct solution here indicated, which is Tpn, the total parenteral nutrition, with no additives. We have our infusion rate of 62.5 ml per hour with a duration of 24 hours. And we make sure that the volume of our solution is correct as well, which is 1,500 ml. And the vascular access site we're going to use will be the central venous site of the patient. After that, after confirming the prescription or the order of the doctor, we are now ready on preparing the necessary materials that we will be needing for our Tpn administration. So over here, I have here my Tpn solution. I have here my assuming infusion pump that is integrated already on my IV pole here. I also have my IV tubings here, my PPE, which is gloves or any PPE that is indicated in performing this procedure. I also have here my alcohol swab and my alcohol as well. And then I also have my IV label that is already prepared, and also my medication tray and alcohol and cotton balls for the procedure that we're going to do. After that is I will now be inspecting my Tpn solution together with the IV tubings that we're going to use. So this is my Tpn solution. So for my Tpn solution, what I'm going to first inspect together with my IV tubings is their correct, make sure that it is in correct label. So I will be placing my IV tag here. So here is my IV tag. So I will be reading my IV tag, make sure that it is correct. So it is for patient John De La Cruz, who is 68 years old male, with a solution of Tpn or total parenteral solution and a volume of 1,500 ml. And it is for with an infusion rate of 62.5 ml per hour and the duration of 24 hours. And we will be administering this with include the date of August 20, 2026, and our time started to be assumed is 8 a.m. and we'll also be inputting our time ended to assume, which is for 8 a.m. for the next or the following days, because it will be 24 hours. And of course, I will not be forgetting on including my name together with the signature in the IV tag. After that is I will be now checking for the clarity of my solution. So as I can see here, hindi na po natin nakita yung ating pag-roll ng ating mga bawat section. But make sure that the solution of our Tpn is indicated or as indicated. So as here, there is no presence of any discoloration. So we have a milky white color, which is indicated by the manufacturer, as well as there is no presence of any remnants or any disintegration in my solution, which is an indication that it is okay or it is safe to use. Together is I will also be checking for the integrity of my solution. So as I can see here, there is no presence of any leakages and the package is still intact, making sure that the integrity is good. This is also, I will be also checking that on my IV tubings. There is no presence of any breakage or cuts, so the integrity is okay. After that is I will be checking for the expiration date. So as included on my Tpn solution, it will be expired as written here. It will be expired on September 1, 2029, and my IV tubings will be expired on August 11, 2029. So both are safe to use by my patient. And after that is I will also be checking for the functionability before I administer it. So I make sure that all of the components are here, as well as my IV tubings. I will also be checking the functionability of that after I open the package later on. So after I make sure that all of the necessary materials are prepared and ready, I am now going to my patient to do my patient identification, communication, as well as in gathering their consent. So assuming po na pupunta po kay patient, so here is my patient po. So as assumed lang po. Okay, so I will now be introducing myself. So good. And I will be making sure that I will be identifying them with the use of A2 identifiers. I will be telling them what is the procedure that I'm going to do, what is the benefits together with the risk of the Tpn administration, what is the process of the procedure together with how can I obtain or how can I gain their consent and cooperation throughout the procedure. So I will now be starting. So good day, sir. I'm Abrece, and I'm a student nurse sa Pamantasan ng Luzon ng Pasig. Before we start, may I know your name po? How about your age and your birthday? May I see your ID band? So as I can see po, just to confirm, you are patient John De La Cruz. You are 68 years old, male, and you are born on October 1, 1568. Is that correct? Okay po, so that's correct. So, sir, what I'm going to do po, so what I'm here is that I will be giving po yung Tpn administration po natin. So, yung Tpn administration po natin ay ito po yung pagkain po natin na ipapadala po muna dun sa ating dun po sa ating ugat. So, bali po, hindi pa po kasi kaya ng inyong katawan or ng inyong pong digestive tract or ng inyong stomach na makapag-absorb or makapag-process pa po ng pagkain. Kaya po, ipapadala po natin yung pagkain po natin sa inyo po, sa inyo pong ugat. So, liquid po ito na ipapadala po natin sa inyong ugat. Ito po ay, ang mga benefit po nito ay para mabigyan po kayo ng sapat na nutrisyon habang hindi pa po kayo pwede kumain sa pamamagitan ng bibig. Ang contain po nito yung mga electrolytes, mga vitamins, yung mga carbohydrates, yung mga fats po na kailangan po na inyong katawan para hindi po kayo mamayat, hindi po kayo mawalan ng lakas dito po sa pagsinyo sa hospital. Together po, sabihin ko lang din po sa inyo na meron pong mga risk po yung ating po procedure. So, since open po yung ating or nakakonect po ito sa inyo, maaari pong magkaroon po ng infection. Together po, baka maaari pong makaroon tayo ng mga reaction at mga allergic reaction po. Pwede po rin tayo magkaroon ng hyperglycemia or pagpapataas po ng ating blood sugar. Pero po, wag po kayong mag-alala dahil ito naman po ay maiibsan or maiiwasan natin dahil imo-monitor naman po namin kayo ng maigi. So, importante lang po na malaman po ninyo para po nakapag-report po kayo sa amin kaagad kung may maramdaman po kayo ng paninikip ng dibdib, pananakit po dun po sa inyong swero, at kung may makita man po kayo ng ibang mga reaksyon na hindi po normal, katulad po na nasabi ko kanina. Gayun din po, ito po ay maglalast, so it will last for about 24 hours po. Sa isang buong araw po ito, naka-connecta po sa inyo. Ito po yung magsisilbi na pagkain nyo po sa isang buong araw. Ito po ay temporary lamang, pero titignan pa po natin yung katagalan po ng paggamit nyo po ng solution na ito or ng pagkain sa pagdaloy po ng inyong gamot ugat, depende po sa sasabihin po ng ating doktor. Okay? So, maaari ko po bang makuha po yung consent po ninyo para po sa pag-administer ko po ng TPN po natin? Okay po, may mga katanungan po ba kayo bago po tayo magsimula? Okay po. So, after that, I'll also be making sure that I will be verifying the informed consent that is being obtained po according to the institutional policy, whether it is through handwritten document or especially if it is required in the institutional policy po. And since the patient agreed and did not refuse on the procedure, I will now be proceeding. After that po, is what I'm going to do is I will be performing hand hygiene po, together with I will be also donning my gloves. This is to make sure po that we maintain an appropriate antiseptic technique principle as we do the procedure po. Okay, and then after that is I will also be making sure to go to my patient and then assess for my patient's site na kung ano po yung gagamitin natin. For TPN, it is usually the central venous site that we're going to use. And also, I will be obtaining their vital signs to have a baseline so we could compare it before and after the administration of my TPN. So, sir, assess ko lang po kung ano po yung gagamitin natin. Okay, so assuming po na the patient has already the central venous site or nakakonekta na po dun po sa ating pasyente yung central venous catheter. What I'm going to first to do before administering is to check ko po yung site. So as I can see naman po dun sa site, there is no presence of any redness, swelling, or there's no presence of any infiltration, levitis, or any signs of infection on the site. So sir, may nararamdaman po ba kayong sakit dun po sa ating site po? Assuming that it is collected on the mainland, may pananakit po ba dun po sa swero po na nakalagay po sa inyong gandang leeg? Wala naman po. So that is an indication that the site is okay or okay for us to administer our TPN or our total parenteral nutrition po. So, bali sir, dito po natin ipapadaan po yung ating TPN po. Okay? So, hayaan nyo lang po muna ako na ma-prepare po yung ating solution na ibibigay ko po sa inyo or ikakabit ko po sa inyo mamaya. Okay? So, after that is I will be making sure now to prepare my TPN solution. So, I have here my TPN with me. So, I will be preparing first the IV line of the patient and the TPN infusion according to the institutional policy while maintaining the sterility of our TPN. After that is I will be making sure that I will be applying the safe administration principle for safe medication principle before initiating my TPN infusion. So, the 12 principles are make sure that we have the right patient, the right medication, the right dosage, the right route, the right time. We make sure to have a right documentation, the right assessment, reason, education, evaluation, and the right of the patient to refuse, and for them, the right to clarify. So that is already 12. I make sure that I will be embedding that in my mind, for I can give a safe administration of my total parenteral nutrition. After that is I make sure that I will be disinfecting the white port of the main line to make sure that before connecting ng aking TPN, this is for us to maintain the sterility and together avoid any contamination. Okay. So after that is I will be making sure to incorporate now my TPN. So first that I'm going to do is to hang my TPN on my plate. And open my okay, so I will be spiking. So assuming po na i-spike ko po ito. And then we will be filling our volumetric chamber for about and half, and make sure po muna na we are going to prime this. So kailangan una muna is naka-close yung, naka-make sure natin na kanina po na naka-close yung ating IV tubing, and then we're going to open it para po makapag-prime po muna tayo ng tubing natin, making sure that there is no bubbles before we connect this to our patient, and of course infuse this on our IV pump. So assuming po na naka-prime na po yung ating tubing, i-close po muna natin yung ating roller clamp, and then we will be now connecting sa ating patient yung ating connection po. And then we also make sure po na we be able to prime with removing all the bubbles before po natin i-connect to sa patient, because this is very harmful po. So as I have here po, I will now be attaching po muna yung ating tubing dun po sa ating IV pump. So, kahit assuming po ito yung IV pump, ipapasok ko po ito sa loob ng ating IV pump. And then, after ko po mapasok sa loob ng aking IV pump is, I make sure po na i-regulate ko ito depende sa regulation na binigay ng doctor, which is 62.5 ml. And of course, yung aking volume na 1,500 po. So, after po nyan, is I will now be connecting this dun sa aking pasyente po. So, make sure po na na-disinfect na po natin ito, katulad ng pag-disinfect po natin kanina. And then, we will be making sure po na i-attach po natin to securely. And then, with the use of our tape, make sure po na secure po natin ito dun po sa ating Y port. After po na is we are now going to make sure po na i-open natin ito, and na-monitor ay mare-regulate po natin yung ating infusion pump sa kung ano po yung prescribe po ng ating doktor, together with together with yung ano po yung binigay po sa atin ng doctor, together with the proper institutional policy po. And then we also make sure to change and adjust this depending if meron po tayong makita na changes po dun po sa prescribed na infusion rate po ng ating doctor. And then after nun po is we are now going to do our patient monitoring po, since we have administered our TPN. So for here po, I will be monitoring my patient if they have any complication po, such as any adverse reaction, if there's any infection, or especially if it is catheter related dun po sa ating site. And then together if the patient have any hyperglycemia, if it is peripheral po, if meron po mga fluid overload, allergic reaction, and of course if there's presence of any infiltration or extravasation po, leakage po, dun po sa aking site. So good day po sir, check ko lang po muna. Kamusta naman po yung nararamdaman ko ngayon? Wala naman po kayo nararamdaman na paninikip po ng dibdib? Wala naman po, no? Masakit po ba pag dumadaloy po sa inyo? Okay po, so I can see po here, there's no presence of any leakages naman po. Secure naman po yung ating connection po dito, wala pong leakage, and I can see po na there's no presence of any yellowish or any purulent discharge. That could be an indication of infection po. And as I can see naman po na maganda po yung pagdaloy ng aking infusion pump, and maganda rin po yung patency ng aking line kasi po patuloy po yung pag-flow ng aking medication po. After that is I will also be making sure po na i-check po muna natin yung vital sign ng patient po natin to make sure that we have a proper comparison po dun po sa initial na vital signs natin at dun sa last po or sa ngayon po na vital signs natin after the patient is ongoing medication of the TPN and after they complete the Tpn administration po. And after that po is I will be making sure on providing my patient reassurance together with the correct patient education due to the administration or because of the administration of our Tpn administration. So, sir, ganito po ha. So, nabigay ko na po yung ating TPN. Bali, ito po yun. Yung solution po dito kung makikita po natin. So, sir, bigyan ko lang po kayo ng paalala na hindi po dapat natin tatanggalin po yung connection po dito po sa ating swero. Huwag din po sana nating galawin. Ito pong roller clamp po natin at pindot-pindutin po yung ating infusion pump, ano? Kasi po kalkulado po yung ating gamot na ibinibigay po sa inyong katawan para rin po mapanatili na magiging safe po yung pagbibigay po natin ng pagkain po natin, ano, yung sa ating solution sa inyong katawan. So, kung meron man po kayong ma-experience na kung sakali po tumunog man po yung infusion pump, kung nakita nyo po na biglang nag-stop, or meron po kayo naramdaman na kahit na anong reaction po sa gamot natin, at dun din po sa area ng ating swero or kung saan po na itusok o na ipasok sa inyong swero, ay magsabi rin po kayo kaagad sa amin para po ma-report po natin kaagad sa inyong doktor kung papalitan po ba natin yung ating ibinigay na solution at kung ano po yung maagapan po natin, kung ano man po yung reaction na mararamdaman niyo po kapag po natapos po natin yung TPN solution. Huwag po kayo mag-alala at I assure you po na babantayan at i-monitor ko naman po kayo lagi. At saka po, i-check ko rin po lagi yung, or every 6 hours po, yung inyong pong glucose sa pamamagitan po na pagkuha ng kaunting dugo po sa inyong kamay para po ma-check po natin kung ma-experience po kayo ng hyperglycemia. And that is very important if we are doing a peripheral po na venous site. And then after that is, after I give my patient the reassurance, patient education, and of course, the instructions for their safety, I am now going to make sure to perform the infection prevention control po. I will be disposing all the used materials that I have here. So, ito pong aking mga wrapper, yung aking pong alcohol, mga wrapper na ginamit sa aking alcohol, and yung aking swabs. And that I will be disposing them according to the healthcare waste management and of course the DOH and the DENR guidelines in the proper waste management. After that, I make sure to don my gloves and perform hand hygiene. And I will not be forgetting to perform po nung aking and then po I will not be forgetting po nung aking communication sa aking patient. So as I do my communication po, I will be first making sure that I have the proper documentation. So as I document po, I will be making sure that I have here po yung correct na administration po ng aking gamot sa aking pasyente. I have the correct solution with me, which is yung TPN solution po natin. Yung aking volume po, which is yung 1,500 ml po na ating TPN solution. Yung infusion rate natin na 62.5 ml. Yung ating vascular access site na ginamit po, which is yung ating central venous site. Together with my patient assessment. So, I will be incorporating this na wala pong irregularity or sudden abnormality po dun po sa aking site. Together with wala rin naman pong any irregularity or adverse reaction na naramdaman si patient. On per patient response is na-tolerate naman ni patient yung ating procedure and nakapagbigay ng consent yung ating pasyente. And of course, if there's any adverse reaction or allergic reaction, I will be noting that immediately on my documentation chart. After After that is I make sure to provide communication or proper communication to my client. So I will be making sure that I will be communicating effectively po sa aking pasyente katulad po ng binigay ko kanina. I will be communicating effectively po sa aking mga healthcare team, and that is through the proper documentation and informing them that I have given the TPN solution sa aking pasyente, and then I will be demonstrating my presence towards my client even after the procedure, and of course with the use of my therapeutic communication. So, sir, maraming salamat po sa pag-cooperasyon ninyo sa procedure po na ito. Kapag meron po kayong kailangan at meron po kayong concern o po kayong mahihiya na tawagan po ako o mag-raise po ng concern sa akin. So tapos na po yung ating procedure. Yung mga binigay ko po sa instruction kanina, wag mo po kakalimutan, ha? Okay, so that will be all. So, and that will be the end of my TPN administration po.